Hi, my name is Missy Miller Mallory, and for my health campaign for APC201, I did mine on healthcare associated illnesses, and specifically dealing with hand hygiene. So my target audience would be the healthcare community, as it is upon them to actually keep healthy hand hygiene while interacting with patients and caregivers, and also interacting not just in personal contact, but also in touching things that the patient would touch. So as we all know, as we go into a doctor's office or medical facility, there is periodically throughout the space, there is places for the doctor or the nurse or the medical professional to sanitize their hands. And within every hospital room, there is a hand washing station with soap and water. But still, 1 out of every 31 patients will develop a healthcare related illness due to unhealthy hand hygiene from the medical professionals. That's staggering. That's a pretty steep number to go into the hospital seeking that medical help and yet come out with or potentially have an extended stay due to a healthcare associated illness, one you did not intend or go into that situation with. So for my campaign, I came up with 2 different scenarios to help with this crisis, if we can call it that. I think we can, with 1 out of 31 patients developing a healthcare associated illness. So I came up with a poster, one that could be hung at all stations throughout the hospital or healthcare facility. It is bright in color. It's also red, so that it shows attention. There is the large attention stated at the top. I chose the design to be like a beehive, so that it symbolizes that we all need to work together to help the healthcare related illnesses cut down in volume. We all need to work together. And so that goes hand in hand with my second healthcare communication message that I came up with. Throughout most medical professions, they do have team huddles periodically, maybe once a day, maybe once a week, or even bi-weekly. But they do have these huddles where they talk about upcoming issues and things that they want to address with the staff. So my thought was to present a scenario. So they were interacting with a patient, perhaps a doctor and a nurse, or a medical professional, nurse practitioner, whoever would typically go in together. So there would be a team. So if one of the medical professionals did not happen to wash hands upon entering the room, there would be a code word that they could give out. That they would then alert the other one, and not the patient or the caregiver sitting in the room, that hand washing did need to take place. It could be, hey, did Don update that file? And Don being the code word for soap, just the thought. It could be however that medical professional facility wanted to handle that code phrase or word, but one that would not alert the audience or the caregiver, the patient, that they did not wash their hands upon entering that room, just to keep that healthy hand hygiene. So those are my 2 safety measures. 1, placing those posters everywhere. And 2, patients and caregivers may ask the medical professional, hey, I noticed there's a lot more posters about healthy hands and hand washing. And that would spark that conversation between that healthcare provider and the patient, which is healthy. It's good. It's needed. And it will help greatly cut down on the healthcare related illnesses. Thank you.